Okay guys, karibuni sana kwa Strict Talk TV again, a new episode, and today tunamaka pre-launch. Tuko na pre-launch ya World AIDS Day Marathon, half marathon yenye itakuwa ina happen pale at Nyayo Stadium, and we have one of the young person tunataka kumuuliza maswali hapa kuhusu the triple threats. Ni aje bro, unaitwa nani?
Naitwa Jose Macharia.
Jose Macharia. Very good. Mimi vile nilisema ni Alan Sirima. No, Joseph Macharia. What does triple threat mean?
Triple threat from the word threat isn't something zenye ziko alarming. Na one of them ni unintended pregnancy, tuko na sexual gender based violence, and the third one is about HIV infections ama HIV and AIDS.
Nice, very good. Now what are some of the causes? Tumekuja kuona numbers, tumeona young people ndio most, tumeanza kuona tumeona new HIV infection among young people in a pile up, inaenda juu. What do you think should be done so that we can reduce these cases?
We can do quite a number of things. Number one is about the age-appropriate comprehensive sexuality education, so that we can be able to cascade HIV information to these adolescents at their tender age, because we tend to assume that they are not engaging in sexual intercourse, but by the data that we can get even from today from the Ministry of Health, we've seen quite, like you can imagine a 10 years old pregnant, so by the time they are 23 years old, she's a grandmother. So you see, so it can be able to replicate even to their generation. Let me use that word. Yes. So the best way is about doing what we call the multi-sectoral approach, whereby the Ministry of Health and Ministry of Education, whenever maybe they are coming up with a curriculum, they can incorporate about age-appropriate comprehensive sexuality education, so that they can be informed quite at a tender age, so that they can be able to make informed decisions which can be able to be of great positive impact for them in the near future. And like we've seen today, because of the data that we've seen from the Ministry of Health, we've seen about stock out in condoms, and courtesy of that you find young people or maybe adolescent girls indulging in sexual intercourse, not condomizing during that sexual intercourse, so making it increasing the numbers of teen moms in the data, and also making it to be kind of hard for us in ending now the triple threat. But when we have like what we call the multi-sectoral approach, whereby young people, they come on board, also the ministry, I feel that also there is need for them to be intentional. Not just by having good policy, but in terms of implementing, we are not doing so. So let our advocacy be evidence-based, and also let it be driven by the data that we have seen from the Ministry of Health.
Nice. Hizo ni insights zingine fiti sana. Now the last question, what will be happening on 30th November? Yes.
So on 30th of November, it will be World AIDS Day. Today is on 15th of November. So today we were doing what we call the pre-launch, just setting the goal straight, and also seeing what we are anticipating to have. So during on 30, it will be a marathon. So whereby we'll be having different stakeholders. It will also be for person with a disability, because we'll have a half 21.5 kilometer for the half marathon. We'll also having 10 kilometer for the small one, and also the 5 kilometer for the corporate, and also the other. So maybe you might be there at home, maybe you feel like you are not maybe an athlete, but you come on board as a family, bring your children on board, you as a person that you champion for HIV. You remember, this is not for people infected with HIV, it's also for people affected, because if you might not be infected but you are affected, you might have a neighbor, maybe courtesy of maybe their lived experience, or maybe they have something that is bothering them. It might affect you in one way or the other, maybe directly or indirectly. So come on board on that day. Let's champion for HIV, for it even to get for people even to even to be facilitated, because we've seen early this year there was what we call the donor from the USA, from the government, from United States of America. And you see, courtesy of such many programs and many people living with HIV, in terms of accessing maybe ART or maybe their ARVs, it has become quite cumbersome. And now we are coming on board on such a day, so that at least we can show unity, we can show unison, and the hashtag is let's end ending AIDS or triple threat by 2030. So before then, let's started the journey today. and we've seen even we started it last year, so this will be our now second marathon. Exactly.
Nice. Actually kuna kitu muongea Jose, something you spoke about ile stigma, you know, last year 2024 when we were having such an event, nilivai t-shirt, and then when nilikuwa naenda home mtaani watu walikuwa wanauza ini t-shirt ya watu wa HIV, so inamaanisha uko affected na HIV, you see. Man, mimi pia nilipatwa na hiyo stigma, and I'm an advocate, you can imagine. So unaweza imagine mtu mwenye hajakuwa kwa field alafu ameonekana amevai t-shirt, and then someone anasoma anaona HIV and AIDS. Unaweza imagine. So kuna kitu muongea, hiyo ni kitu kingine ya maana sana. So also on that particular day pia tutakuwa tuna jaribu kufight stigma, by the way. Na stigma ni noma sana when it comes to HIV, si ndio? Nimeona hii kitu because mimi kama mimi nilitensa, I'm an advocate, I've been into this field for almost 30 years, nimekuwa nikichampion against HIV and AIDS. Na someone aliniambia hivyo, nikasikia niko na uoga, hata hii t-shirt nilikuwa nataka kutoa. By the way, this t-shirt sikuanga na ni karibu niache kuvanga hata mtaani pale whenever I'm going to advocate. But thank you for bringing out that insight ya fighting stigma. Na mtu akiona hii t-shirt ama akiona una fight HIV, unaongelea sura ya HIV, anafikiria uko HIV AIDS. Thank you very much Joseph. Guys, mtu follow for the next episode ya Triple Threat, tutakuwa tunaletea correct information on HIV and AIDS. Na
itakuwa tunapatana date 30 hapo hivyo Nyayo Stadium. Race itaanzia hapo hivyo, maybe unaweza kukimbia, tunaweza tembea, we come walk, we come tujibonge. Also tuna understand about mambo na integration ya mental health, tukiongelea mambo na HIV. Hawa si wanaendanga mambo na wakienda for ART wanahitaji psychosocial support. So come to support yane. Nawa ni mandugu zako, huu ni bro yako, huu ni mkoro, huu ni jirani, huu ni nani, no, you never know. Niyo tu support yako, na kusupport si ati ni do, we tu kama show up, tuoneshane tuko na what we call solidarity. So see you then, take care, and history na stigma tuiache. Na tunachanga aje, si kuambia jirani yako ache, tunaanza na we personally. Naacha, wewe ukiacha, alafu hiyo effect inaendelea hivyo kama wildfire, si ndio?
Thank you very much bro. Asante sana.
Adios.
Muchachos, to work hard siku zote. Siku zombo. Aleko behind the camera. Noma sana. Yeah.